This video is the property of Hill Oral Surgery. Any distribution is prohibited. Hi, I'm Dr. Marcus Hill. Thank you for taking the time to watch this consent video on dental extractions, and thank you for trusting me with your care. Many teeth can be saved with dental fillings, crowns, root canals, but when they cannot, I'm happy to help. If your dentist recommended they be removed, then I can either remove your tooth awake using numbing medication, or you can be sedated in the dental office. Lidocaine is numbing medicine, often referred to as Novocaine. With numbing medicine, you will always feel pressure and vibration the same way as if you were fully awake without anything. And I push pretty hard when I take out your teeth. You will hear noises from the drill as well as the cracking and crunching of the tooth being removed. That said, you shouldn't feel anything sharp, and if I push my finger really hard against your gums, you will always feel that pressure. But if I used a knife and cut through the gums and pushed the same as hard, it'd feel just like my finger. Just pressure, nothing should actually hurt. To remove your teeth under IV sedation is usually a much better experience. When you come in, we will start an IV in your arm, give you medications through it that make you relaxed and sleepy until you don't care what's going on. And when you look back, you will likely not remember anything that happened. You will be deeply sedated, but it's still very safe because you're still breathing on your own, your blood pressure's maintained, you're not intubated, you're just checked out. The lights are on, but nobody's home. While sedated, you will get all the same numbing medication as if you were fully awake. So when you wake up, nothing should hurt. You should be fully numb without any pain. Now the pain will start to slowly increase as the numbing medication wears off, and you'll want to take an NSAID like ibuprofen if you're able to take it as soon as you get home. We will also prescribe a mild narcotic for you to take only if you need it. I recommend you take the narcotic a half tab at a time because you can always take the other half an hour later if your pain is still intolerable. The pain does get worse over the first 3 days and usually peaks on the third day, and then it slowly resolves. To minimize the pain and swelling, we recommend that you ice your face most of the day of surgery as well as the following day. This helps prevent pain and swelling. The swelling usually peaks on the third day as well. Erupted teeth have a lower risk of long-term complications than impacted teeth. There is still a nerve, though, that runs through your jaw and gives you feeling in your lip and chin. The risk of permanent nerve damage to this nerve is only around 1% with extractions. However, it can be bruised. There's also a nerve that goes to your tongue, but that has an even less likely chance of being damaged, and again is usually temporary. The upper teeth are near the sinus cavity, and there's only an eggshell-thick bone between the tooth and the sinus cavity. If we take that tooth out and there's any hole, you could risk having a hole between your tooth and sinus cavity. And if you blow your nose, you could blow bacteria from your sinus into the healing socket. This can cause an infection, delay the healing, and if it does not resolve on its own, it may require an additional procedure. Although the risk of serious sinus complications is low, try to avoid blowing your nose for at least the first week after surgery to help it heal better. If you do have sinus irritation after the surgery, an over-the-counter sinus decongestion medication is recommended. You can also spray saline into your nose and inhale. Just try not to blow your nose or create that pressure. The most common complications with dental extractions are bleeding and infection. Now, if you don't have any bleeding problems and you aren't on blood thinners, then this risk is very low. Following the procedure, bite down on the gauze and follow the post-operative instructions. Infection, however, is a legitimate risk. To minimize this risk, I will write for a prescription-strength mouth rinse and an antibiotic. Now, I want you to start these the day before the surgery and continue for the week after to minimize the risk. Another common complication is root fracture. If a small piece of root breaks off, I may choose to leave it. That fractured piece is unlikely to cause a problem. It will usually stay right where it is without an issue. To dig it out would cause more pain, swelling, and risk to the structures around the root tip. If it ever does come to the gum surface, then it will be easy to remove. In order to get the tooth out easier, we may remove bone or split your tooth into pieces prior to removal. This allows us to make a smaller hole so you heal up faster. Don't be alarmed if somewhere in your sedated state you hear a drill. This is normal and expected. I place sutures in most sites to help you heal faster. They are usually unnecessary and will not be replaced even if they fall out, no matter how soon. The sutures dissolve on their own, and there is nothing you need to do with them. Don't pay them any attention. Please read through the detailed consent form you were just given. The paper consent, rather than this video, is the actual consent. You may also visit my website, hilloralsurgery.com, for more information about me and to watch this video again. If you want sedation on the day of surgery, there are 2 important things that you must do. First, have nothing to eat or drink for 8 hours prior to the surgery. This includes water, nothing to eat or drink the morning of the surgery. 2, you need to have a driver come with you, stay with you the whole time, and take you home afterwards to make sure that you're taken care of and safe. I look forward to meeting you on the day of surgery. Thank you for trusting me with your care. Don't be nervous. This is safer and way easier than you imagine it to be. Thank you for your time and trust.